Hi, I'm Dr. Julie Shen. Today I will talk about radiation. First, I want to share my journey from China to the United States. So I was born and raised in mainland China. My hometown is a beautiful city called Chongqing. And then I went to university, like Southeast University in Nanjing for my undergraduate study. So Nanjing is also a beautiful city in China. It's actually the capital of China for 6 dynasties. So it has a very rich history. And Southeast University has one of the best biomedical engineering program in China. So I'm very proud to be able to attend that. After I finished my undergrad, I came to the United States. First, I spent some time in Cleveland, actually a long time in Cleveland. I did my master and a PhD in the Department of Biomedical Engineering at Case Western Reserve University. And then I stayed in Cleveland. I joined Cleveland Clinic as a postdoc scholar and also did my residency in medical physics at Cleveland Clinic. And then I moved a little to the east to Pittsburgh. I became an assistant professor at the University of Pittsburgh Medical Center. I was there for about 3 years before I joined USC. So I traveled all the way from Midwest to West Coast. So this is where I'm working right now at the USC Norris Cancer Hospital. So today I'm going to talk about radiation. I actually asked my son, William, he's 10 years old. I asked him, what do you know about radiation? The first thing he told me is, radiation is dangerous. Is radiation really dangerous? I want to show you a quick video from TED Talk.
When we hear the word radiation, it's tempting to picture huge explosions and frightening mutations. But that's not the full story. Radiation also applies to rainbows and a doctor examining an X-ray. So what is radiation really, and how much should we worry about its effects? The answer begins with understanding that the word radiation describes two very different scientific phenomena: electromagnetic radiation and nuclear radiation. Electromagnetic radiation is pure energy consisting of interacting electrical and magnetic waves oscillating through space. As these waves oscillate faster, they scale up in energy. At the lower end of the spectrum, there's radio, infrared, and visible light. At the higher end are ultraviolet, X-ray, and gamma rays. Modern society is shaped by sending and detecting electromagnetic radiation. We might download an email to our phone via radio waves to open an image of an X-ray print, which we can see because our screen emits visible light. Nuclear radiation, on the other hand, originates in the atomic nucleus, where protons repel each other due to their mutually positive charges. A phenomenon known as the strong nuclear force struggles to overcome this repulsion and keep the nucleus intact. However, some combinations of protons and neutrons, known as isotopes, remain unstable or radioactive. They will randomly eject matter and/or energy known as nuclear radiation to achieve greater stability. Nuclear radiation comes from natural sources like radon, a gas which seeps up from the ground. We also refine naturally occurring radioactive ores to fuel nuclear power plants. Even bananas contain trace amounts of a radioactive potassium isotope. So if we live in a world of radiation, how can we escape its dangerous effects? To start, not all radiation is hazardous. Radiation becomes risky when it rips atoms' electrons away upon impact, a process that can damage DNA. This is known as ionizing radiation, because an atom that has lost or gained electrons is called an ion. All nuclear radiation is ionizing, while only the highest energy electromagnetic radiation is. That includes gamma rays, X-rays, and the high energy end of ultraviolet. That's why, as an extra precaution during X-rays, doctors shield body parts they don't need to examine, and why beachgoers use sunscreen. In comparison, cell phones and microwaves operate at the lower end of the spectrum, so there is no risk of ionizing radiation from their use. The biggest health risk occurs when lots of ionizing radiation hits us in a short time period, also known as an acute exposure. Acute exposures overwhelm the body's natural ability to repair the damage. This can trigger cancers, cellular dysfunction, and potentially even death. Fortunately, acute exposures are rare, but we are exposed daily to lower levels of ionizing radiation from both natural and man-made sources. Scientists have a harder time quantifying these risks. Your body often repairs damage from small amounts of ionizing radiation, and if it can't, the results of damage may not manifest for a decade or more. One way scientists compare ionizing radiation exposure is a unit called the sievert. An acute exposure to 1 sievert will probably cause nausea within hours, and 4 sieverts could be fatal. However, our normal daily exposures are far lower. The average person receives 6.2 millisieverts of radiation from all sources annually, around a third due to radon. At only 5 microsieverts each, you'd need to get more than 1,200 dental x-rays to rack up your annual dosage. And remember that banana? If you could absorb all the banana's radiation, you'd need around 170 a day to hit your annual dosage. We live in a world of radiation. However, much of that radiation is non-ionizing. For the remainder that is ionizing, our exposures are usually low, and choices like getting your home tested for radon and wearing sunscreen can help reduce the associated health risks. Marie Curie, one of the early radiation pioneers, summed up the challenge as follows: "Nothing in life is to be feared. It is only to be understood. Now is the time to understand more so that we may fear less."
Okay, so that's a nice short video, and hopefully that gives you some idea about radiation. Now let's dig deeper. What is radiation? Radiation is energy released in the form of particles or electromagnetic waves traveling in air or medium.
Dr. Shen, I think William had a question.
Oh, okay.
How much radiation? What is the most potent and deadly radiation? Wait, let me take that question. What place has the most radiation on Earth?
What's the last part?
What place has the most radiation on Earth?
I guess nuclear power, like a nuclear plant, like those power plants.
It's Chernobyl.
Yeah, the one
Yes.
that had
Yes.
the disaster.
That's right. Good. Thank you, William, for that question. But we're actually going to talk about which one is the most dangerous one. Yes. So yeah, thank you for the question. Let's look at the electromagnetic spectrum. So it's a spectrum, and the thing you are familiar with, for example, visible light, here is only a very small portion on the spectrum. And if we move to the left side of the spectrum, it has longer wavelengths. And if we move to the right side, those radiation has shorter wavelengths. So how do we define wavelengths? It's from one point to the next identical point. So if we look at the peak here and we measure length to the next peak, that will tell us about the wavelength of that particular radiation. And you can see from visible light, we come in this way. We can have infrared and then microwaves and the radio waves. So the wavelength gets bigger. And the longer the wavelength, it actually is corresponding to lower frequency, meaning in the same time, you can fit fewer cycles in there, and that's also lower energy. So towards this side, that's lower energy. And when you move to the right side of the spectrum, you can see you can fit more cycles in the unit time. So that corresponding to high energy, high frequency, which is also high energy. And let's take a closer look. So start from visible light, and we can have infrared and then microwave here. You guys all have microwave oven at home, right? And the Wi-Fi signal your phone or your laptop uses, that's also in this microwave range. You probably have noticed sometimes when you are using the microwave to heat up food, your phone signal or your computer network signal is actually gonna get interrupted. That's because they are using similar frequency. And then when we move on to even longer wavelengths, we have the radio waves. That's where we can get the radio and the TV signal. And they have very long wavelengths and they can travel very far. And now we can move to the right side of the spectrum. From the visible light, we can get to the ultraviolet, that's the UV light, and then go to the higher energy X-ray and the highest energy gamma rays. So when we think about dangerous radiation, that's the ionizing radiation, we are mainly talking about X-ray and gamma rays. And let's take a closer look at each of them. So for non-ionizing radiation, the one on the left side of the spectrum, they are lower energy electromagnetic waves. They do not have enough energy to pull electrons from the orbit, but they can excite the electron to get the atom to the active state. Remember, they are not so dangerous, and we encounter them in our daily lives. For the ionizing radiation that's on the right side of the spectrum, they have higher energy electromagnetic waves, such as X-ray or gamma ray, or they are high energy particles, such as beta particle and alpha particle. So these radiation have energy high enough to pull electrons from the orbit, giving rise to ions and free radicals. So these free radicals can cause DNA damages. They can be dangerous. There are three common types of ionizing radiation: alpha, beta, and gamma. So for alpha, it's basically the fast-moving helium nucleus. It can stop just by a piece of paper or even your skin. So even though it has very high energy, but it cannot penetrate too deep. Next one is beta. It's a high energy electron. It can be stopped by an aluminum plate. The third one is a gamma ray. It's basically a high energy photon. They can only be stopped by very dense materials, such as lead or stainless steel. Now let's talk about the biological effects of radiation. The high dose of radiation usually cause acute biological effects. When William mentioned that accident, so those people are exposed to very high dose of radiation, they're probably gonna suffer from acute radiation syndrome, ARS, including nausea, vomiting, skin burns, hair loss, and ultimately death. And then for low dose of radiation, they usually cause chronic effects. We already heard they can cause cancer, and when you get older, that accumulated dose might also cause cataracts, so in your eyes. And then the most important one is the genetic mutation of offspring. So that means not only you yourself will get some chronic biological effects, but also your children. Those muted DNA will get to your children. So that could also be a very bad thing. And then how can we minimize the radiation exposure? How can we protect ourselves? There are 3 factors you should think about: time, distance, and shielding. Time, you want to be minimize your time in the radiation exposure. Get out of there as soon as possible. Distance, you want to keep a big distance from the radiation source as far as possible. There's the inverse square rule. So the farther away, it's actually it's a square effect. So you get even better protection. And then finally, shielding. So for example, when we're treating cancer patients, we are using very high energy. So the treatment room is shielded by very highly dense material, such as heavy concrete or lead or stainless steel. So that will protect you. Even for non-ionizing radiation, like UV light, you want to apply sunscreen to protect your skin. The same concept. Now I want to share some historical events happened related to radiation. So in 1895, Wilhelm Conrad Roentgen discovered X-ray. So that's the first year he discovered X-ray. And in 1901, just 6 years later, he received the first Nobel Prize in physics for his discovery of X-ray. So it's a very important scientific discovery. And then in 1903, Maria Curie, Pierre Curie, and Henry Becquerel received the Nobel Prize in physics for their contributions in understanding radioactivity. And then I want to share some fun facts with you. Fun fact number 1, Roentgen is a unit for radiation exposure. Curie and Becquerel are units of radioactivity. So if you do a good job and you discover something significant, so maybe your name will be used for some scientific unit or some equation. So study hard and work hard. Maybe one day your name will be there. And then fun fact number 2, International Day of Medical Physics is November 7th. That's Madame Curie's birthday. So we just celebrated the 10th International Day of Medical Physics this past Monday. So do you want to do a quick summary?
Yeah, absolutely. So yeah, no, I was like trying to figure out, is now a good time? So what we just reviewed, right? Yesterday, I used the words good radiation and bad radiation, right? And we just got more detailed about that. So good radiation, like the visible light or the not too bad UV light, just like what we have in our flashlights, right? Like this one's not going to give us a sunburn the way the UV light from the sun's going to. All of that is non-ionizing radiation. You want to say that together? Non-ionizing radiation. Non-ionizing radiation. You don't have to unmute. I see most of you want to stay muted. That's okay. And then the other type of radiation, what I call the bad radiation, the radiation that has dangerous effects, that's the ionizing radiation. So if it's non-ionizing, it's not so dangerous. If it's ionizing, then it's dangerous. Any questions on that? All right, we'll let Dr. Shen tell us all about the medical uses of radiation, and then we can get into some questions.
Okay, wonderful. So even for those bad radiation, we can make some good use of that. So that's why I'm going to talk about medical use of radiation. There are 3 main branches using radiation in medicine, including radiology, radiation oncology, and nuclear medicine. Radiology is a branch of medicine that uses X-rays and other high-energy radiation to diagnose and treat disease. There are 2 subfields, including diagnostic radiology and interventional radiology. Diagnostic radiology uses many imaging techniques, including X-ray, CT, and MRI. And the radiologist can interpret those medical images and give disease diagnosis that will help other physicians to treat that disease. And for interventional radiology, they use medical imaging to guide minimally invasive surgical procedures. They use needles and catheters through blood vessels, arteries, and organs. So if you think about surgery, like open chest surgery, the physician needs to cut through many layers, including skin, muscle, fat, and even through bones. So it can be very invasive. It can cause a lot of damage to the patient. When we're talking about minimally invasive, we are using the natural organs or some blood vessels or arteries, so they are already there. And the interventional radiologist can use needles and catheters and go through those. And that could be very damage to the patient's normal tissue can be minimized. So that's why they call minimally invasive. This is a graph showing how X-ray works. So here you can see is the X-ray generator, and then patient is lying down on a treatment couch. And on the back side, there's the X-ray detector. It's usually like a panel of imaging detector. I mean, the patient can also be sitting or standing. And when the X-ray generator can have X-ray going through the patient's body, it gets attenuated when it hits the detector. Remember, your bones are more dense than your soft tissues. So after the X-ray going through, most of them got attenuated, and the bone is gonna show up as bright, and then the soft tissue will show up as dark. So you can kind of see, oh, this is a hand, maybe there's a fractured arm right there. And another technology using X-ray is called computed tomography, CT. You probably heard about the term CT. You can see it has a donut shape CT scanner, and patient is on a couch. The couch can go inside this donut hole, and it actually gets a cross-sectional image of the patient's body. And once we have a series of transverse images, we can reconstruct to make a 3D image of the patient body. Another imaging technique is called magnetic resonance imaging, MRI. You probably heard about this term, MRI. Again, it has a donut-shaped scanner. Patient will go through these. Again, it will get a series of transverse images. But you can also get a 3D reconstruction. So usually we get 3 views. It's called transverse view here. You see the plane cutting, kind of cut off the patient in the axial view, or sometimes we call transverse view. And then there's also a sagittal view here, or the coronal view here. And MRI is usually images on the brain, because for CT, it's hard to see some of the details of the brain structure, but MRI is very good at soft tissue distinguishing. So it's usually used for brain, as shown here, or spine, because for the spinal cord here, MRI is really good for imaging the spinal cord, and you can also see the spine, the bony structure here. And then the second branch is called radiation oncology. That's actually the department I'm working in. It's a branch of medicine uses carefully targeted doses of high energy radiation to kill cancer cells. And it has 2 subfields, external beam radiation therapy, EBRT, and brachytherapy. So for external beam radiation therapy, it usually includes a photon, and that's mainly X-ray. It can also be gamma ray, and also has electron and proton. The radiation is coming from outside of the patient. That's where the term external coming from. The second subfield is called brachytherapy. Brachy is a Greek word for short distance. So for brachytherapy, it's using radioactive source or isotope. You watch that in the video. The isotope, they are radioactive. So we can put those radioactive source inside the patient to treat the cancer. So this time, the radioactive source is inside the patient, so it's very short distance. That's why we have this brachy, the Greek word for short in this name. Here is a figure showing the external beam radiation, how it works. We have this machine called linear accelerator. Sometimes we call it LINAC. It can rotate around the patient while the patient is laying down on the treatment couch. The LINAC head generates a high energy MV X-ray shooting at the tumor. In order to make sure we are treating the correct tumor, we have a lot of patient image guidance, including the optical surface guidance, or other camera can look at the patient. So we make sure we are shooting the high energy X-ray at the tumor and spare the normal tissue. For brachytherapy, we can see this is inside the treatment room, and the treatment room can be shielded. And then outside the treatment room, we have the control room. That's where the therapists, physicians, and the physicists will be there, so we can be protected. And inside the treatment room, we have a device called afterloader. Inside the afterloader, there's a radioactive source. So most of the time, it's inside this so-called afterloader, which is heavily shielded. So that way, it's safe for the healthcare team. And then there's a transport tube connected to the applicator, which will be placed inside the patient body. Most of the time, we are using brachytherapy to treat prostate cancer or for cervical cancer. So in this case, once the physician places the applicator inside the patient body, everyone leaves the room, and then the radioactive source will come from this shielded afterloader, go inside the patient's body. And then we treat the tumor. Once the treatment finishes, usually a few minutes, 10 minutes, and then this radioactive source gets retracted back inside this afterloader. So remember, the radioactive source is inside the patient body, so it's a very short distance. It gives away very high dose to the tumor. The third branch is called nuclear medicine. It's a branch of medicine that uses radioactive material to diagnose or treat disease. Again, it has two subfields. One is for diagnosis, the other is for treatment. For diagnosis, the most common one is called positron emission tomography, PET. In this case, radioactive tracer is injected, swallowed, or inhaled by the patient. And most of the time, PET is done together with CT. That's why you heard sometimes it's called PET-CT. So that's for imaging diagnosis. And then for treatment, commonly used nuclear medicine is radioactive iodine. The isotope is called iodine-131. It's commonly used to treat thyroid cancer. I think that's what I have for the presentation. And we can do some fun activities. Or do you want to do some other summary?
Yeah, we can summarize again too. So we just learned
Mhm.
about 3 different ways that we use radiation for medical uses, right? We learned about radiology, which is how we take images of our body using radiation, and we have different methods of taking those images. And I'm going to come back to that in a second. And then we learned about radiation oncology, where we learned about 2 different methods of how we use radiation and how we deliver radiation to a patient to help fight cancer. So some of those are external to the patient, where the source is outside of them. And then brachytherapy, remember brachy means short, is going to be internal to the patient, going to be inside their body. So it's a very short distance, brachy, very short distance to the source, or to the area that we're treating, the tumor if you have cancer, right? And then we just learned
Mhm.
about nuclear medicine, which are some other ways that we can administer radiation to our patients to either get more images like the PET CT scan, or to so that helps us diagnose, or to treat them. So help once again break down those tumors. So I think what Dr. Shen's going to show us now are some X-ray images. And are you all ready to guess what's going to be shown? So we're going to see X-ray images first, and then the next slide we're going to see CT images. So remember, we have many different ways that we can image the body with radiation, but these are 2 really important ones. So get your
Mhm.
thinking caps on. Let's get ready to
All
guess.
right. Yeah, let's get ready. So
All right.
remember, yeah, the bright regions, those are the bony structures.
So who has a guess? What region is this? What can you see in this image? Adifa, go for it.
I can see the head and mostly the neck is the part of it, the picture.
Nice. I agree with that. Sophia, do you see more? What else do you want to add?
The teeth and the bones.
Yeah, I agree. Does anyone see anything else? Oh, Alejandro, what do you want to add?
I see the sides of the body part bones of the human.
I like that you're pointing out which side we're seeing, right? We
Mhm.
talked earlier about sagittal and transverse and
Mhm.
coronal, which are different ways we can view the body. So this one would be sagittal because you're seeing
Sagittal.
it from the side, just like Alejandro pointed out. Sophia, what else do you want to add? And then Nila, we can, if you want to add anything.
A skull.
Ooh, a skull. I like the words we're using. These are some great
Mhm.
terms. Nila, did you have more to add? Or did everyone cover it? Yeah, go for it, Nila.
I forget.
That's okay. If you remember, feel free to guess. But otherwise, I think that's all the guesses we got. Did we cover
Mhm.
everything, Dr. Shen?
Yeah, that's excellent. Yeah, so mainly this one we call it the head and neck region. So I think you guys covered it. Yeah, I think even the first girl covered it nicely. Yeah, so you can see the head and neck. So someone mentioned the skull, that's great. And then the teeth, absolutely. Yeah, everyone's correct. Okay, now let's look at the next one.
Ooh, all right. Who has guesses for this one? Adifa, go for it. And then William.
Mostly the lungs in the picture.
Ooh, you can identify the lungs. That's great. William, did you want to add anything, or were you going to say lungs as well?
No.
Were you going to say lungs? Okay. Alejandro and then Sophia.
I can mostly see the lungs, but I can kind of see the chest bones.
Oh, nice. I agree with
Yeah,
that.
yeah, rape. Yeah. Mhm.
Sophia, did you have more to add to that?
Yes, I see the ribs, the stomach, a heart, lungs, and organs.
Wow, yeah, you got
Wow.
a lot in there. Good job.
Good job. Yeah.
Nila, did that cover everything that you were going to guess, or did you have more to add? That covered it? Okay. Oh, wait, did it? Wait. You can unmute if you have something to add, but I think you're good. Okay, I don't think Nila has a guess. I think we're good.
Okay, all right, wonderful. Yeah, so this is the chest region, or medical term is a thoracic region. Yeah, you guys all said correctly. So you can see the lungs, yeah, and then you can see the rib cage, yeah, and then someone mentioned the heart. Very good observation. I really like that. Okay, now let's move on to next images, X-ray images.
Ooh, who has a guess for this area, this region? What do you see here? Oh, Juan, what's your guess?
So I think it is I think it is like the stomach, because I could kind of see the neck, and I can kind of see the yeah.
Okay, okay.
heart.
I like that you're trying to use all your
Mhm.
context clues to identify it. That's great. Sophia, you're so excited. What's your guess?
Your ribs, your spine, your thighs, and wait, is that a spine or a backbone? I forgot what it was called.
Both of those words work. Yeah, spine or backbone. I
Fine,
agree.
yeah. Mhm.
Any other guesses or things that people identify? All right, I think that's it for guesses, Dr. Shen.
Okay, so this is the pelvic region. So you can see the pelvic bone, iliac, and then you can see the femoral head. So yeah, so this is a
Yeah,
tough
like-
one, I guess. And hip,
Like
yeah.
Sophia said, those
Mhm.
bones, what she just called the femoral heads, those are the top of your thigh bones. So Sophia saying thighs was like dead on. That was
Thighs,
really good.
yes. Oh
Yeah.
yeah, that's right. Yes, good job. All right, next one should be easy.
Oh, Adifa.
It's the hand bone with all the joints and the fingers to make a whole hand.
Absolutely. Great job,
Ooh.
Adifa.
A lot of details.
Oh, Neela, did you have something to add? Go for it.
You could see a little bit of the tendon.
Oh, you can see the soft tissue. Is that what you're pointing out? Like not just the bones? Yeah, I agree with that.
Hmm.
Sophia, did you have something to add?
You could see your finger bones and the bones that are right here on your paw. I forgot.
Yeah, the ones that make your wrist.
And your wrist.
Hmm. Yeah,
Awesome.
awesome.
I think those are
yeah, great. Yeah, those are all correct. Yeah, it's the X-ray of the hand. And another fun fact is the first X-ray is actually the wife of Rankin, and in fact, that picture also shows her wedding ring. So like very cool. All right, next one is relatively easy, hopefully.
Alejandro, what is it? What's your guess?
I see the feet bones.
Yeah, or feet bones. Does anyone? Oh, Sophia, did you want to add to that?
I could see also the feet bones, and there are many parts of them to make them move. And also, I forgot what the under one, like where the under the feet bones, like the toe bones.
Oh, yeah. I agree with that. Does anyone else have anything to add? Adifa, what else do you see?
I also see the tarsals and the metatarsals.
Mhm.
Great job.
Ooh,
Yeah.
wow. Wow, medical terms. Awesome.
Yeah. So for everyone else, those mean your ankle bones because Adifa used a big word there. Great job.
Yes, this is the X-ray of the feet. Yes, excellent job, everyone. The last one here.
Oh, Adifa, what do you think? And then Neela.
It's the knee bone.
Okay, the knee bones. I like that. Neela, did you have something to add or was that your guess?
There's also core bones.
Like your leg bones, if it's a
Yeah.
knee? Is that what you're saying? Yeah. Alejandro, did you want to add anything?
I think it could either be the arms and the elbow, or it could be the legs.
Mhm.
I like the way you're thinking. That's great.
Mhm.
Sophia, what did you want to add?
It's a femur, like it's one of your longest bones you have.
I do agree with that. Our thigh bone, our
Mm.
femur, is the longest bone in our body. Juan,
Mhm.
what did you want to add?
I was gonna say ankle.
Your ankle?
Yeah.
Okay, I like that guess.
Mm-hmm.
I think that's everyone's guesses. So Dr. Shen,
Okay.
what's the answer?
Yeah, the answer is this is the knee. You can see the kneecap. That's one clue. Yeah, I remember someone mentioned this is femur. That's one of the like that's the largest bone. Yeah, that's correct. And then over here you have the tibia and fibula. So yeah, I guess you can also think about this could be a elbow, but but the kind of kneecap kind of give away. Excellent, everyone. I like how you are thinking. And next one, we're gonna move on to CT. Yeah, CT, you can see more details about the soft tissues. All these images are like a cross-sectional. But back here, sometimes we have the sagittal, we have the coronal. Most of them are from like the side view or something like that. But the CT, usually we show a series of axial view, or we call transverse view. So let's start with this one here. Any guess?
So a couple other details. So
Oh yeah.
Dr. Shen, do you mind going to the previous one with the X-ray images for just a moment?
Oh yeah.
So if we're looking at the feet picture here, that perspective of looking down at our feet is how we're looking at all of the CT images that we're about to look at. So I just wanted to make sure that everyone's thinking about it that way. We're not going to see any side views or front views. We're going to see top-down views, okay?
Mm-hmm.
All right, so now back to the CT images, a reminder. So in the previous one, if we saw white, we knew that meant bone. So if we see white here, that does mean bone. If we see dark gray, that's going to mean soft tissues or organs. And if we see black, it means like either outside the body, we're not imaging it, or it means air trapped inside the body. And that's because air is less dense, so it doesn't give as much of a color for the CT images. So we're going to see it as black, okay? So now that all being said, what's your guess for the first one? Neela, what's your guess?
The top of our head.
Ooh, okay. I like that. Our brains. Sophia, is your guess? What's your guess?
The brain.
The brain. Okay, we got 2 votes for brain. Juan, what's your guess? Juan, you're muted.
Let me see. I vote for the brain.
Okay, you agree with brain. Adifa, do you also say brain, or do you have a different idea?
Yeah, the brain, because I feel like the white part that's around it is the skull.
Ooh, I like the way you're using your context clues. That's great. Alejandra, do you have something else to add?
Everyone says brain but me though. I actually think it's like a part of the tailbone.
Oh, okay. So like maybe like how we saw the hip bones, like the pelvis. Is that what you're thinking of? Okay, I like the way you're thinking. I think that's it for guesses, Dr. Shen.
Okay. Yeah, let's reveal the answer. It's the brain. Guess, but I like the last girl's her thinking. Yeah, like outside the box. I like that. Cool. And then the next one.
Ooh, Sophia, what's your guess?
Your teeth and your, I forgot what this one was called.
Like your jawbone?
Yeah, your jaw.
Okay. Adifa, did you want to add to that?
And your
Oh, and your tongue.
Yeah, I was gonna say the same thing.
Okay. Awesome. We have a lot of agreement. Neela, what did you want to add?
I agree with Sophia.
Okay, so we think we see our jaw and our teeth. All right. Does anyone see anything different? All right. Oh, Alejandra, what do you see?
I think I kind of see I think it's like I think it's like looking at the head like this.
Oh, I see what you mean. Yeah, it looks a little funny, huh? Seeing only the bottom part of our teeth. Awesome. Dr. Shen, what's the answer?
All right, let's reveal the answer. It's the neck region. Yeah, I guess it's the head and neck region, and you can see the teeth, absolutely. Yeah, jawbone and spine. Yeah, great. All right, next
Awesome.
one. Yeah, awesome job. This one's a little tough, but give you a clue. You have a bony structure here. You have some bony structure here on the side.
All right. Juan, what's your guess?
You gotta kind of think hard for this one. It's actually like it's kind of like an arm, but it isn't. That's one of the clues, I think.
Well, so what's your guess?
I actually hold up. Let me think. Come
Okay,
back.
let's give Sophia an opportunity to guess. Let's see.
The teeth.
Oh, your teeth. So you think it's like a close up, right? Okay, okay. So remember that we have 3 bones in a row here, right? We have one on the left and one in the middle and one on the right. Does that help? Does that change anyone's answer? Neela, what's your guess?
I think it's the shoulders
Oh, your
and
shoulders.
your collarbone.
Okay. Alejandro, is that what you were going to say?
No, I just wanted to say that the brain bone like one looks like it's kind of in there. It looks like it's in the other 2 pics.
Oh, I see what you mean, where it's like kind of like if we zoomed out or something. Okay, I see. Adipa, what's your guess? Did you want to add?
I think it's the jawbone.
Oh, okay, okay. We only have a few more minutes, so let's go ahead and end the guesses there. Dr. Shen, what's the answer?
All right, the answer is shoulder. Very good. Yeah, so I think you guys, some of you mentioned like it looks like arms. That's correct. And yeah, that's the shoulder region. Awesome. That's a tough one. Next, any guess?
Juan, do you have a guess? What's your guess?
I guess it's a tissue.
Well, yeah, anything we see that's gray here is going to be a soft tissue or an organ. So what else do you want to let Alejandro guess, or do you have a guess for what organ you might be seeing or what part of the body you're seeing?
Okay, maybe it's something. Yeah, I think it's like a big tissue. Wait,
Okay.
I think it's the lungs. It's lungs. I think lungs.
Okay. Okay, Alejandro, what's your guess?
It's obviously the lungs because as you said, the air is a black and there's a lot of black and the black is making a shape of lungs.
Oh, I like all these context clues. Neela, what did you want to add?
I think it's the lungs too, and the rib.
Okay. All right. So let's end the guesses there. So Dr. Shen, what's the answer?
The answer is the chest region. Yes, you guys can see the dark region are the lungs. Excellent. All right, let's move on to the next. Good job.
All right. So what's the next one? Juan, do you have a guess for what part of the body this is?
Did you know that kind of looks like a brain?
It does kind of look like a brain. So is that your guess?
No. My guess is like it's like a tummy.
Oh, okay. Okay. Does anyone else have a guess? Neela, what's your guess?
I think it's our stomach.
Our stomach. Okay. Dr. Shen, what's the answer?
Yeah, the answer is the abdomen region. So yeah, it's your tummy, and you can see these are we call the bowel loops. Yeah, and then some of the like a large bowel, they have gas. Remember, gas is air, so it's dark. So yeah, very good. Last one, yeah.
Who has a guess for this last one? Ooh, Adifa, what's your guess?
I think it's like maybe the teeth, because I can see like maybe some teeth on the bottom of the picture.
Okay. Anyone else have a guess? Neela, what's your guess?
I think it's our like thighs.
Ooh, our thighs again? Okay. we do have to move on to the next activity. So Dr. Shen, what's the answer to this last?
Okay, the answer is the pelvis region. So you can see your hip bones, you still see some of your bulk inside. So yeah, that's the pelvic region. Awesome, that's all I have for you guys.
Awesome. Thank you so much, Dr. Shen. Can we give Dr. Shen a round of applause? That was awesome. I hope you all learned so much about radiation.
If you have questions, here's my email.
Awesome.